Welcome to this online training module that discusses birth control options for new mothers. As you are aware, the Northwestern Health Unit is currently working towards achieving designation as a baby-friendly organization. As a public health nurse employed with the Northwestern Health Unit, you have the opportunity to work with new mothers in one capacity or another, perhaps as part of delivering Healthy Babies, Healthy Children services, providing sexual health clinic services, or when offering immunization services to infants and families. It is important that all our public health nurses have at least some degree of familiarity with this topic in order to provide consistent messaging to clients. Over the course of the presentation, you will be learning about the impact that different birth control options have on breastfeeding and why staff familiarity with this topic is relevant to the Baby-Friendly Initiative and the work the Northwestern Health Unit is completing to achieve baby-friendly designation. Once you have completed this module, you will need to complete a short quiz and receive a mark of no lower than 80%. The birth of a new baby is an exciting time that brings with it many things to consider. A woman's options for birth control is one of the many things new mothers need to take time to inform themselves about in order to make an informed decision about what method will work best for her. As the Northwestern Health Unit strives to achieve our baby-friendly designation, we continue to maintain a strong focus on our efforts to support, promote, and protect breastfeeding in all Northwestern Health Unit communities. This includes ensuring new mothers have the information they need to make informed choices about reliable birth control methods available to them, as well as the impact each method has on breast milk supply. Accurate information enables a mother to choose a method that will not hinder the breastfeeding relationship she has with her infant. As a public health nurse, you play a key role in ensuring that mothers have access to the accurate information required to facilitate informed decision-making. It is important that women planning to breastfeed take into consideration the impact their choice of birth control will have on their efforts to successfully breastfeed their baby. Choice of birth control and its impact on breastfeeding can be broken into 4 categories. The birth control method can have either a positive effect on breastfeeding, no effect on breastfeeding, no adverse effects on breast milk supply, or it can have an adverse effect on breastfeeding. You may be wondering what the difference is between no effect on breastfeeding and no adverse effect on breast milk supply. No effect on breastfeeding refers mainly to barrier methods, where the method provides a physical barrier to prevent pregnancy and has no effect on amount or quality of breast milk. ECP is an exception in this group. It is hormone-based, but exposure is brief, it's a one-time dose, and it has no proven effect on breast milk supply. No adverse effect on breastfeeding refers to methods that are hormone-based and should not affect the amount or quality of breast milk. On the next few slides, these 4 categories will be discussed in more depth. Lactational amenorrhea method, or LAM, is the only birth control option that has a positive effect on breastfeeding because it requires a baby feed frequently at the breast to produce a natural contraceptive effect on fertility. It helps to build and maintain good milk supply and does not hinder the mother-infant breastfeeding relationship. The name of this method identifies 2 of the key components that must be present for this method to be successful. The mother must be breastfeeding and must have no monthly period, hence the name Lactational Amenorrhea method. There are other key criteria that must be present for this method to be effective, and these will be discussed further on a later slide. The lactational amenorrhea method is a temporary form of contraception for new mothers whose monthly bleeding has not returned. It requires exclusive or full breastfeeding day and night of an infant less than 6 months old. According to the World Health Organization, this method is 98% effective if used correctly. The mechanism of action for the lactational amenorrhea method is further discussed in the most recent version of the Canadian Contraception Consensus published by the Society of Obstetricians and Gynecologists of Canada. The primary mechanism of action of LAM is the suppression of the hypothalamic pituitary ovarian axis, which occurs when a mother breastfeeds her baby at the breast. This suppression of the hypothalamic pituitary ovarian axis results in decreased luteinizing hormone production and results in no ovulation. Although ovulation may occur when using LAM in the first 6 months postpartum, ovulation and the luteal phase preceding the first menses rarely have the normal characteristics required to support a pregnancy. LAM is an effective method of birth control if the new mother answers yes to all of the following 4 criteria. The first is my baby is less than 6 months old. The mother must be less than 6 months postpartum. The World Health Organization recommends exclusive breastfeeding for baby's first 6 months. At 6 months, introduction of solid foods with continued breastfeeding is recommended. With this introduction of solid foods, an infant is no longer considered fully breastfed. The second is my monthly period has not yet returned. Once a woman's monthly period has returned, she is ovulating, so another form of birth control will have to be used. Return of menses postpartum is defined as any bleeding that occurs after 56 days or 8 weeks postpartum that is perceived by the mother as menses or lasts for 2 consecutive days. The third is my baby is fully or nearly fully breastfed. Fully breastfed means that the baby gets all of his food from suckling at the breast. Pumping or hand-expressing milk from the breast does not guarantee the same effect on fertility. It is the suckling at the breast that suppresses the hypothalamic pituitary ovarian axis or the hormonal cascade responsible for suppressing ovulation. Nearly fully breastfed means that the baby receives breast milk from suckling at the breast and no more than 1 or 2 mouthfuls of liquids other than breast milk, such as express breast milk substitutes, formula, or water per week. It is important to note that this does not include any necessary vitamins, minerals, or medications. Parents should be counseled that it is important to continue to provide baby with the recommended daily dose of 400 international units of vitamin D per day. And the fourth and final criteria is my baby breastfeeds at least every 4 hours during the day and at least every 6 hours at night. Frequent feeding at the breast is required to produce the natural contraceptive effect on fertility. Babies should be feeding at least every 4 hours during the day with no more than 1 6-hour sleep stretch in a 24-hour period. If a woman is not planning a pregnancy and has answered no to even one of the previous 4 statements, she will need to use another form of birth control, as LAM cannot be considered a reliable form of birth control for her. Mothers are still encouraged to continue breastfeeding for their health and the health of their baby. Ideally, mothers who are using the lactational amenorrhea method should be counseled and encouraged to plan ahead and to think about what other method of birth control they will start using when any one of the 4 criteria are no longer met. There are several methods of contraception available which have been shown to have no effect on breast milk supply. These methods are discussed on the next 2 slides. Condoms, both male and female, have no effect on breast milk supply. Condoms provide a barrier method of contraception that can be used anytime and are the only contraceptive method that helps to prevent sexually transmitted infections or STIs. Clients who have new or multiple sexual partners should be counseled to use condoms for STI protection regardless of whether or not they are using another method of contraception. For new mothers, lubricated condoms have the added benefit of providing lubrication that may be needed to relieve vaginal dryness that can occur during breastfeeding. In terms of effectiveness, the male condom is 85 to 98% effective at preventing pregnancy, whereas the female condom is 79 to 95% effective. Spermicides such as foam, gel, sponges, and the vaginal contraceptive film have no effect on breast milk supply. Spermicides are absorbed into the mother's blood and may be secreted in breast milk with no known effect on the infant. Most spermicides can be used anytime, however the spermicidal sponge should be delayed until at least 6 weeks postpartum. It is important to note that due to spermicides being associated with epithelial damage that can increase the risk of HIV transmission, this method of contraception is often not endorsed or promoted by Northwestern Health Unit's sexual health team. Spermicidal gel, foam, and vaginal contraceptive film have an effectiveness of 71 to 82%. The spermicidal sponge has an effectiveness of 68 to 80%. The effectiveness of spermicides is increased when used with condoms. The diaphragm and cervical cap provide a barrier method that has no effect on breast milk supply, however should be used in conjunction with spermicides. Spermicides used with these products are absorbed into the mother's bloodstream and may be secreted in breast milk with no known effect on the infant. It is important to note that diaphragms and cervical caps must be refitted postpartum and can be fitted at the mother's 6-week postpartum checkup. Use of a diaphragm with spermicide has an effectiveness of 84 to 94%, and use of a cervical cap in spermicide has an effectiveness of 68 to 74%. These effectiveness rates are based on studies in which the diaphragm and cervical cap were used with a type of spermicidal jelly that is no longer available in Canada. Unfortunately, there is no data on the effectiveness of these products using the lactic acid buffering gel commonly known as Kaya gel or Contragel that is currently available for use with these products in Canada. Therefore, women selecting this method must be willing to accept a higher risk of unintended pregnancy. Fertility awareness methods, such as the calendar method and symptothermic control, have no effect on breastfeeding. However, fertility signs and symptoms are difficult to assess in a woman who is breastfeeding. Furthermore, these methods are not recommended until a woman's monthly period has resumed. Effectiveness of these methods range from 75 to 99%. To use fertility awareness methods effectively, specific instruction is often needed. The withdrawal method has no effect on breastfeeding and can be used at any time in the postpartum period. Although evidence shows that the effectiveness of this method ranges from 73 to 96%, the Northwestern Health Unit Sexual Health Team does not endorse or promote this method because of the potential that pre-ejaculate may contain sperm. According to the Society of Obstetricians and Gynecologists of Canada, studies have shown that theoretically there are enough motile sperm in the pre-ejaculate of some men to fertilize an egg. One study of 27 men and 40 samples of pre-ejaculate fluid found that 37% contained a reasonable number of motile sperm. As a result, mothers who select this method must be willing to accept a higher chance of unintended pregnancy and may want to consider emergency contraception in circumstances where there is any contact between the ejaculatory fluid and the vulva or vagina. The non-hormonal IUD, or the copper IUD, has no effect on breast milk supply. The non-hormonal IUD can be inserted immediately after birth or up to 48 hours postpartum. However, it's more likely to be expelled within the first 48 hours postpartum. It is usually inserted after 4 weeks postpartum. This method is suitable for women seeking longer-term birth control that is reversible and effective, or for women who require emergency contraception and are not suitable candidates for the emergency contraceptive pill. The effectiveness of the non-hormonal or copper IUD is 99%. There is some data suggesting that there may be an increased risk of uterine perforation among postpartum and breastfeeding women. The emergency contraceptive pill, also known as ECP, Plan B, or the morning after pill, contains progestin only and has no effect on breast milk supply. There has been no proven effect on the infant from the hormones. ECP must be taken as soon as possible within 5 days of unprotected sex. Effectiveness varies significantly depending on maternal weight and timing of administration and ranges from 58 to 97.7%. Vasectomy has no effect on breastfeeding. It is permanent and considered not reversible. It may take several months to be effective. Backup contraception should be advised until post-vasectomy semen analysis is completed and confirms sterility. This method has an effectiveness of 99.5%. Tubal ligation has no effect on breastfeeding, but efforts must be taken to preserve and maintain breast milk supply while the mother and infant are separated, as well as during mother's recovery. It is permanent and considered not reversible. This method has an effectiveness of 99.8%. This slide discusses the birth control methods that have been shown to have no adverse effects on breast milk supply. No adverse effect refers to methods that are hormone-based but do not affect the amount or quality of breast milk. These methods contain progestin only. There is no data to date suggesting any effect on the infant from the hormone content associated with these methods. The mini pill is a progestin-only pill that may be started immediately postpartum. However, it is preferable to wait until at least 6 weeks postpartum when breastfeeding and breast milk supply are well established. This method has an effectiveness of 91 to 99.7%. It is important to note that the effectiveness of this method is dependent on the woman taking the pill at the same time each day within a 3-hour window. This formulation of the contraceptive pill does not contain a hormone-free interval. Depo-Provera is an intramuscular injection of progestin that may be started immediately after birth, however is not usually recommended until 6 weeks postpartum, preferably when breastfeeding and breast milk supply are well established. To remain effective, a repeat injection every 3 months is required. This method has an effectiveness of 94 to 99.8%. The IUS with hormone or intrauterine system with progestin may be inserted immediately after birth up to the first 48 hours postpartum or should be delayed until at least 6 weeks postpartum. If inserted within the first 48 hours postpartum, there is an increased risk of expulsion. This method has an effectiveness of 99.8%. As with the IUD, there may be an increased risk of uterine perforation when used among breastfeeding and postpartum women. There is theoretical potential that progestin-only contraceptives, including the mini pill, Depo-Provera, and IUS, may impact milk supply when started in the early postpartum period before milk supply is established. A drop in progesterone levels after birth is necessary for lactogenesis 2 to occur. Therefore, initiating a progestin-containing method of birth control within 48 hours of birth may potentially impact lactogenesis 2. However, there is insufficient data available at this time to determine risk. As a result, it is recommended to delay until 6 weeks postpartum if at all possible before starting these methods of contraception. Another potential consideration, if milk supply decreases following administration of Depo-Provera, this method of birth control cannot be discontinued or removed. For this reason, it is sometimes suggested to try a shorter acting version of progestin-only contraception, such as the oral form, before proceeding with the longer acting form, such as the injection. Although Plan B, or the emergency contraceptive pill, contains progestin, the hormone exposure is brief and unlikely to impact breast milk supply, even if given before milk supply is well established. As previously mentioned, studies have shown that there may be an increased risk of uterine perforation related to IUD and IUS insertion among postpartum and breastfeeding women. As illustrated in this chart, both breastfeeding at the time of insertion and insertion up to 36 weeks after giving birth were associated with an increased risk of perforation. When inserted less than or equal to 36 weeks postpartum, breastfeeding women had a perforation rate of 5.6 per thousand insertions compared to non-breastfeeding women who had a perforation rate of 1.7 per thousand insertions. When inserted at greater than 36 weeks postpartum, breastfeeding women had a perforation rate of 1.6 per thousand insertions compared to non-breastfeeding women who had a perforation rate of 0.7 per thousand insertions. As a result of this risk, women contemplating the use of intrauterine contraception postpartum should be encouraged to discuss the potential risks and benefits of these methods with their healthcare provider. The birth control methods that studies have shown to decrease breast milk supply are the combined pill. It's a pill taken once daily that contains estrogen and progestin. The contraceptive patch. It's a patch that contains estrogen and progestin that is applied to the skin once weekly for 3 weeks every month. This method may be less effective in women weighing more than 198 pounds or 90 kilograms. and the contraceptive ring or the Nuva ring. It's a flexible ring that is inserted into the vagina once every 28 days that contains estrogen and progestin. It is removed after 21 days and a new ring is inserted 7 days later. All of these methods contain estrogen and progestin. These hormones have no known effects on the infant, but studies have shown that estrogen reduces breast milk supply. These methods have an effectiveness of 91 to 99.7%. Use of these methods should be avoided by breastfeeding mothers until at least 6 months postpartum. According to the World Health Organization's medical eligibility criteria, use of contraceptive methods containing estrogen and progestin among breastfeeding women before 6 months postpartum requires clinical judgment and are not usually recommended unless other, more appropriate methods are not available or not acceptable. Breastfeeding women who are less than 6 months postpartum and who are contemplating the use of a combined hormonal contraceptive method must consult with their healthcare provider before use. If at all possible, other methods of contraception should be explored and encouraged before resorting to hormonal contraceptives containing estrogen. It is also important to note that these methods of contraception should be delayed at least 6 weeks postpartum regardless of the mother's selected infant feeding method. Now that you have an understanding of the contraceptive options that are available to new mothers, you might be wondering about what you can do to help support a new mother in selecting the contraceptive choice that is right for her. As a public health nurse, your specific role will vary depending on which program you work in. Regardless of your program, here are a few additional strategies that you can consider incorporating into your practice. When working with new mothers, take opportunities when possible to talk about contraception and to provide clients with accurate information. Have relevant resources and condoms available in your office or practice setting. Stay knowledgeable on ways that women can access contraceptives in your community, including the types of services provided by your local sexual health team. Be team-oriented. At the local level, work with your fellow public health nurses to discuss how all of you can work together to ensure seamless referrals between programs and timely access to services and information. Throughout this presentation, you have learned that all public health nurses, regardless of the program in which they work, play a key role in providing accurate information to clients to facilitate informed decision-making. You have also learned about the various contraceptive methods that are suitable for new mothers and that breastfeeding can effectively suppress ovulation and be used as an effective contraceptive method when all 4 criteria of the lactational amenorrhea method are met. Now that you have completed the module, the next step will be for you to complete a quiz to demonstrate your understanding of this topic. A score of 80% or higher is required. If you do not score at least 80%, you will be given the opportunity to review this module before attempting the quiz again. For more information, you can order the Birth Control Options for New Mothers staff reference tool from the Resource Center. A brochure is also available for you to order to provide more information to your clients. If you have any questions or comments about this training or about birth control methods and breastfeeding, please see the reference list on the next slide or contact the Manager of Sexual Health or the Manager of Family Health. Thank you for your time and attention.